Hello everybody. I have a case of a herniated disc. I treat a lot of patients with herniated discs, and normally I do 10 treatments, and a lot of times there is a big improvement. But I always ask myself, what happened? What happened to the disc after these 10 treatments if the patient is feeling better? But I never had the opportunity, because a patient maybe do a MRI or CT before the treatment, but if he feels better, nobody's going to send them to another MRI. So fortunately, I had an opportunity to have one case where somebody did a CT before and an MRI after she finished the treatment with me. So this is a patient age 32, and she after her 5th childbirth, she has been suffering from a lower back pain and sciatica radiating to her right leg. She has a tingling and pain, and she was limping. She also had incontinence a few times. She couldn't control her urine, and the urine escaped. And she did a CT before she came to see me in May. She came to see me on the 16th of May. And they saw that there is a big herniated disc between L5 and S1, that there's a lot of pressure on the spine, on the nerve, on the root of the spine, and it's more to the right. She went to see orthopedic surgeon, and the orthopedic surgeon told her that she needs to have, she thinks that they should maybe need to have an operation, but he needs, CT is not good enough, he needs an MRI. So he sent her to have an MRI, but it could take time in Israel to get an MRI. So in the meantime, she came to see me for acupuncture. So I treated like I normally do with herniated disc. The main goal is to treat the spine. So I need all kind of points that can treat the spine. I did on the opposite side, on the left side, Wan Chung Yi, Wan Chung Air, 2208, 2209. They are points that are in this area. In Masodong acupuncture, this area represents the spine. We could diagnose the spine and also the kidneys. So I also add small intestine 4. This is a combination I do. These 3 points are very good to treat the spine, and not only the spine, they could also treat the lower back. And on the opposite side, I also added 3 needles that also treat the spine. This a good combination. It's bladder 60, bladder 62, and bladder 65. So these 3 needles together, also James Meyer calls them 3 needles that control the spine. And these 3 needles can also treat the spine, but also they will treat the lower back, especially the Taiyang. This is a Taiyang combination, and it's like, we know that small intestine 3 and bladder 62 is the points to open the governance channel. So I always do these 2 points to treat the spine. Besides that, I add another 2 points that also treat the spine. This was done on the left side. It doesn't matter because the spine is in the middle, so you could do some of the points on the right and some of the points on the left. So I did these points on the right, 11, 12, El Jianming, 2 points that are on the lower segment of the middle finger. The middle finger represents the spine, so these 2 points are the lower spine area. They're also good for lower back pain. And I added also on the same side, on the left side, Sanzheng Ji. So these 3 points, the 3 points that straighten the spine. They are 3 points that are on the side of the arm. The first point is Tutsun above large intestine 11, and another Tutsun, and another Tutsun. These 3 points are very, very good for also treating the spine. So I did 4 sets of points that are treating the spine. I added another 3 points, 3304, 5, and 6 on the left side, These points are the free fires of the hand. They're also very good points for treating lower back pain that's more on the Shaoyang area, more at the sides. And also they are good for treating sciatica. So I added them on the opposite side, on the left side. Okay, so on the sixth treatment, I also did the bloodletting on bladder 40 and also local bloodletting. So normally I do 10 treatments, and after 10 treatments I have a break. So after 10 treatments, the situation was much better. She was not limping anymore. She did not feel tingling in her leg. Occasionally she could have some lower back pain and some cramps in her leg, but she was much better. So I didn't see her afterwards for like 2 years, and she came to see me a few weeks ago because again she had a back pain with sciatica, and she told me something very interesting. She said after she saw me, she did an MRI. I saw her in May, so like 2 months later in June she did an MRI. A month after the treatment she did an MRI, and she said that the MRI showed that the disc was absorbed. Most of the disc was absorbed between L5 and S1, and in September she went to see an orthopedic surgeon, and the orthopedic surgeon told her that he looked at the CT and then the MRI, he compared, he said it seems like she had a natural operation. That's the word she told me. So I quickly told her, do you have the paperwork? I want to see her. Maybe she's making something up. So she gave me the letter of the surgeon, so I'll put it on. I know it's in Hebrew, but I know I also have a lot of students that are watching this video that know Hebrew, so just to see the letter. And you know, it's very interesting that we know, clinical studies show if you take 2 people that have herniated discs and one does an operation and the other one does not do anything, after 2 years the body absorbs the disc. Okay, so that's a natural, we know that this could happen. What was surprising for me, that it happened after 2 months. That's like, I never knew that could happen. So at least one case here, I have proof that maybe acupuncture is very powerful. And that's all the time I tell the patients. They ask me, when they come to me, they say, tell me, what can acupuncture do in a herniated disc? So I tell them that acupuncture could not put the disc back in to place, but what acupuncture could do is treat the inflammation, because when there's a herniated disc there's some inflammation in the area that's also putting pressure on the disc, not on the disc, on the nerve, on the root of the nerve. And also we could help the body absorb the disc into its system. Okay, so I think it's a very nice case. I hope it was also interesting for you, and that's all for now.